Hey, everybody's country 195. Doc Bryce here on the round table, and we're talking with Danna Taylor over at the South Arkansas Regional Hospital that used to be Medical Center of South Arkansas. Good morning, Danna.
Good morning.
Well, I hear that y'all made a transition from the Medical Center of South Arkansas to a nonprofit of South Arkansas Regional Hospital.
That's correct. We did that about a year ago. We've been South Arkansas Regional Hospital since July 1st, 2023. We're working through things. It's been great.
So, what does that mean for the community that y'all have transitioned like that?
So for the community, it means that as a nonprofit hospital, we have a requirement to complete a community health needs assessment, which we did back in the fall. And we will use that information to kind of guide us as we plan in the future.
So, how is the shift from a corporate out of state for profit model to a locally governed nonprofit organization impact the hospital's operation and decision making processes?
Yes, it's a huge difference. So we have a board of directors that is very vested in the healthcare of the community and having the services and equipment we need to serve our community in the surrounding areas. So that has probably been the biggest change. We go to them with our needs and our strategic planning, and they are supportive. They've purchased a lot of new equipment lately, reinvesting in the facility because they know that healthcare is a choice. Patients can travel for healthcare, and we want them to choose us. So that's been the biggest piece. Just really been able to make decisions that are the best for our patients, our community, and the people that take care of our patients.
And speaking of community and community involvement and stuff, y'all have this thing called the Share Foundation.
Yeah, so actually, the hospital was purchased by four foundations coming together to buy and forming a holdings company. And Share Foundation is one of those four foundations that was part of purchasing the hospital. In addition to Share Foundation, UAMS Foundation, Murphy USA Charitable Foundation, and the Murphy Family Foundation. So we have a lot of good support. We're aligning on strategic initiatives that impact our community as a whole.
And with this collaboration, how would this deepen the commitment to the health and well being of El Dorado and South Arkansas?
Yeah, we're still continuing to develop our relationship with UAMS. They're a great partner. Of course, we've established the UAMS primary care clinic on our campus. That clinic will be the future site of the UAMS residency program. So the residents will, UAMS is going through that process, and residents will start in a couple years, and they'll do clinic and then see patients in the hospital. So that's a significant piece of the UAMS collaboration, but also involvement of community health workers in both our case management and emergency management department. Um, just this week, they were here on site talking about changes with Medicaid and um, offerings to patients after they have a baby. So we just get to stay up to date on the newest research, new things happening, and participate in some grant things. So we're really excited about continuing to work with UAMS.
That's really cool. I hear too that South Arkansas Regional Hospital inherited a 4-star CMS rating.
That is correct. Most people don't know that our hospital does really well in national rankings. So we're 4-star with CMS for quality. We have a grade of B with Leapfrog for our safety rating. We're accredited by the Joint Commission, which is a gold standard in healthcare. We're also a stroke ready hospital, a level 3 trauma center, a level 3 nursery. So we do a lot of things to try to make sure that the patients that seek care at our facility receive the same level of care that you would in a big city.
So, what would that mean for somebody listening that they hear that 4-star CMS?
Um, well, most people don't realize that we report a lot of data publicly and to the government, and we're held accountable for not just quality, but also our patient satisfaction scores. So they look at everything from infection control and making sure we're not making patients sicker to making sure we're not, we're not causing further injury when patients come for procedures. So we do really well on our measures. We're really proud of the work we've done in our quality department.
So that's a good thing. So if somebody hears 4-star CMS, that's something that they should be.
Yes.
So last fall, a new inpatient behavioral health unit was opened up.
Yes, that. So we opened in October of 22. It is a brand new state-of-the-art unit. There's a lot of regulations involved with behavioral health or care of those with mental health. What we want to make sure is that people understand that patients suffering from mental health illness need the same care, not the same care, but need access to care just as if they were having a medical emergency such as a stroke or a heart attack. Mental illness is serious and it's real, affects a lot of people, and we want to stop the stigma that's associated with that. Dr. Conley is our psychiatrist, and she's a medical director for that inpatient unit, and it's for adults aged 18 to 64 suffering from mental illness. And it's a program where they get therapy, have activities, and it's a safe place. So we're very excited about the success of that program so far.
That's good. I'm speaking with Danna Taylor on the phone here for the roundtable this morning. Another question I got for you. You were talking about partnering with UAMS.
Yes.
And so with that partnership, how will that enhance the delivery of specialized medical services here in the region?
Yeah, well, we've already made some significant progress in that area. So as I mentioned, UAMS has their primary care clinic, and within that clinic, they are rotating different subspecialists down to see patients so they could see a physician from UAMS and not have to drive to Little Rock. So right now I know there's cardiology, heart failure clinic, there's a electrophysiology clinic. They're looking at transplant in the future. We won't actually do transplant surgery at South Arkansas Regional Hospital, but patients could have visits with a transplant surgeon locally and do their workup locally. Then they'd go to Little Rock for their surgery, and then they would stay in El Dorado and follow up with their same surgeon, but that person would come to them. So we're really excited about moving forward with some of those strategies to keep people from having to travel or bringing care to people that don't have access to it. Stroke is a huge concern in South Arkansas. Oftentimes, people wait a little bit too late before they get care. So we also partner with UAMS with their stroke program and try to provide education to the community on the signs and symptoms of a stroke and that they need to be fast to seek care timely so that they could get the medication they need if it's a clot. So UAMS works really hard to make sure we stay up to date with the new guidelines and things that are facing our communities.
So this is kind of like turning South Arkansas Regional Hospital into like a full service hospital for South Arkansas, yeah?
Exactly. So the intent of South Arkansas Regional Hospital is not to put other hospitals out of business or to take the patients out of surrounding communities. That's not at all what we want to do. Healthcare has changed so much. The cost of care continues to increase. It's harder and harder to recruit talent to rural areas, and reimbursement has not increased with the cost. And so to be sustainable as healthcare providers, we need to look at how to partner with those around us. So I want local hospitals to flourish, and I want them to stay in their communities because not only do their patients need care close to home, but most of the time they are a large employer, and they are a huge driver of the local economy. But what I want to do is work with small communities and facilities around us to figure out how do we partner, how do we offer services that they don't, so that patients aren't all sent to Central Arkansas, but could come, just right next door, get the care they need, and then we'll send them back to their provider for the remainder of their care.
That was next one I was about to ask, because myself personally, I've had a clot issue and went to OCMC, but then they had to ship me off to Little Rock to get the rest of the treatment. So basically, instead of having to get sent off to Little Rock, it's a good 2-hour drive too, to go to Little Rock from here. So instead, basically, you could just run down to El Dorado, a 30-minute drive, and finish out the rest of your medical needs.
Yeah, that's definitely what we're working towards, because everything is more expensive, and so going to Little Rock is difficult for caregivers, for families. Many families are dealing with multi-generational things. They may be helping get grandkids to and from school, or it may be someone trying to work and take care of an aging parent. And so it really helps if a 2-hour drive is not going to have to be factored into their day or their weekend planned. Plus, it's really expensive. So, yeah, we want to work together to offer services and keep patients local. We feel like it's just best for the southern region of the state.
Oh, yeah, because, if you're closer to home, that's a 4-hour round-trip drive to go from here to Little Rock and back, especially if you got to run back to the house, get stuff, and take care of business. Whereas if you run to El Dorado, it's 30 minutes one way. So, at least that's an hour round-trip drive. But it's still closer to home if you need to get back to the house. And like you said, deal with older people, children, and other things you've got going on. Plus, it makes it easier to be able to visit your loved ones, and you don't have to look for a hotel room for the night.
Right. And we have a new group of physicians working in our emergency department, and a new group of hospitalists. That's the doctors that take care of you when you're inpatient. And what we want to make sure is that we continue communicating with your primary care doctor. So if you come from Magnolia and you're admitted, or you come from Camden and you're admitted to our hospital, then we're going to try to make sure your primary doctor knows you're there and gets information from your visit after you leave, so that you can have the proper follow-up. So it really is about partnership and working together.
So it makes it easier for your physician to be able to drive to you, because like you said, if they're based out of Camden or Magnolia and they're going to come see you over at South Arkansas Regional Hospital, that's still a shorter drive.
Yeah. Or they can, get access to the reports and follow up. So we just want to be a good partner, provide good quality care.
So I heard something about y'all have like robotic surgery, something about a DaVinci 5.
Yeah. So actually, we'll start operating with that equipment next week. So we're really excited. DaVinci robotic surgery has been around for a number of years. The 5 is the 5th model. We're the second in the state of Arkansas to get this updated model. And many people are familiar with surgery being laparoscopic, and this is just the next step in minimally invasive surgery. So we will offer general surgery through robotics, and then also urology. And in the months ahead, potentially like GYN surgery. So we're really excited. That is something that's been needed in this area for a long time, because I know many patients travel to get a procedure they need, but they want it done using a robot-assisted technique. So the robot helps the physician visualize the field better, have more flexibility within the abdomen to be more precise, with less damage to your tissue. Supposed to be shorter, minimal scarring, easier recovery, shorter length of stay in the hospital. So it has a lot of good quality indicators and outcomes that we've reviewed from other sites. So we're excited to offer that to the people of South Arkansas.
Well, it definitely sounds like you were saying, bringing big city hospital down to rural Arkansas, and with technology like that, that is big. That is kind of big city hospital stuff.
It is. I'm from El Dorado. I was born and raised here, and I want the hospital that I work at to have the services that my family needs. And I want my family to not feel like they have to go out of town to get the best care. So we're working to do just that, to bring quality care close to home.
That's awesome. So overall, uh, what are the long-term strategic goals for South Arkansas Regional Hospital when it comes to, because I mean, y'all are going to expand over time, I'm sure, with what y'all already bringing here, and you already have some other plans, but what's your long-term strategic goals here?
Of course. So overall, we want to be a regional provider of choice, and just kind of follow up to what I said earlier, working with smaller hospitals to provide, maybe a higher level of care than they can. We want to definitely grow our cardiology presence. We hope to recruit. I know radiology is a big need. I hear over and over patients don't want to have to travel for a diagnostic mammogram. So I assure people all the time we are working to recruit for radiology. We hope to continue to grow in our surgical services. We're very grateful to have full coverage orthopedics, which allows us to be a level 3 trauma center. We have good general surgeons that can take care of all the emergent and elective general surgery cases. And so we want to just continue to kind of fill in the gaps around what we already have so that patients have access to the care they need without travel.
Well, I'm really excited for y'all to be able to do this, and especially bring it close to home, and be able to network with other local hospitals and make it easier for everybody to get that access without having to make it feel like, you got to stay a fortnight,
right.
Up north or central Arkansas or something like that to be able to get the treatment services you need and everything. And you can almost pretty much get it right here in your backyard. Danna, I forgot to ask you, what is your title or position?
Yeah, so I'm the president of the hospital, but I've kind of grown up within the hospital. I started there years ago, actually right out of college, and I've kind of grown up in different positions. I left briefly to get some other experience and finish my master's degree, but I'm currently the president of the facility.
Okay, well, let me end this with one last question, and this is a really hardball question for you. So it's a big surprise, and you don't have to answer it if you don't want to. But do you really love what you're doing?
Absolutely. So, funny story. Actually the other night, my husband was watching TV, and I'm sitting on the couch with my computer, and he said, "Do you think you'll ever retire?" Of course, I'm nowhere near retirement age, but I just can't imagine not doing what I do. So I do what I do because of the people at the hospital, from the staff that take care of the patients, from the support team that do what they do to make sure that patients get what they need, to the doctors. I love what I do. I feel like I'm a servant to the community by leading, and my job is really just to make sure that the people that do the hard work have what they need. So I absolutely love the hospital, and I tell people all the time, you can go places and find maybe a newer facility or a fancier, things, but you'll never find better people than those that we have right inside South Arkansas Regional Hospital.
Well, that definitely sounds like it. And it was a good answer. I had you worried, though, didn't I?
Yeah, I didn't know.
No,
I get asked, the most common question is about the food. That's what people like to talk about. And so we really have good food at our hospital.
Oh, really? Is the cafeteria open to the public too?
It is. It's open to the public. We have a deli, kind of where they make your sandwich while you wait. We even sell deli meat, boar's head meat by the pound. People can come in and place their orders. So our cafeteria is very popular to outside, and we cater. We do a lot of chamber events or at the conference center. So we're known in El Dorado for food. So I encourage you, if you're in town, to stop by and try it.
That should have been my hard-hitting question right there.
How's
the hospital food? Well, Danna, I appreciate you coming on the air with us here for the morning roundtable and talking to us about all the exciting changes happening over at South Arkansas Regional Hospital. And it sounds like y'all have got a really bright future ahead of y'all. And look forward to seeing the other things that y'all are going to bring to the community as well. And I'm just really excited for y'all, and I wish y'all the best.
Thank you so much for taking